Assalamu alaikum and good morning. Good morning viewers, and welcome you all in the lecture of the series of the public health. In the today lecture of the public health, we will discuss the Bismarck model, which is the one of the most famous social health insurance scheme for the people. In the previous lecture, we learned about the social health protection, and we learned briefly about the four type of the model which is exist in the all over the world for the social health insurance scheme. The Bismarck model. In the today lecture, we will discuss about the Bismarck model. Before to discuss about the Bismarck model, let me elaborate once again for you all about the social health protection. The social health protection is the policies or the program of healthcare system in which they provide the healthcare services to every community or the individuals when they are the needed healthcare services. At the time of the healthcare services, when the every community or the individuals will access, he or she will not face the hardship of the health expenditure. This is the whole core theme of the social health protection. And then we discussed that the four type of the model of the social health protections are exist in all over the world, or running in all over the world. The one is the Bismarck model, and second one is the Beveridge model, and third one is the social health insurance scheme, and the fourth one is the OOPS. In the today lecture, we will discuss in detail about the Bismarck model. The Bismarck model has become famous in the 19th centuries after the unification of the Germany. It was introduced and formulated by the first Chancellor Otto von Bismarck. This model, the Bismarck model, is also well known by the first social health insurance scheme, and it is also called the sickness fund. Let us discuss how this Bismarck model work. In the Bismarck model, the employee or the employer both are contribute to pool the revenue for the social health insurance. In this model, both the employer, the employee are the mandatory to contribute for their health insurance as according to their salary package and according to their income. The social health scheme fund or the sickness fund are deducted by the employer and employee in their payroll, and it is pooled in the revenue for the sickness fund. Under this social insurance scheme of the Bismarck model, which is the most famous in the name of the sickness fund, in which everyone must be contribute, the employee and the employer, as per according to their income. And when in this model, the both usually the private sector or the private hospital or doctor also provide the healthcare services. Under the umbrella of this Bismarck model, the every individuals have the choice. Either he will get the healthcare access from the private doctor or the private hospital, or from the public doctor or the public hospital. Under the umbrella of this model, the healthcare cost will be reduced, and then the healthcare insurer or the individuals who would like to get the healthcare access will not face the hardship of the healthcare expenditure. So this model, Bismarck model, is become a very famous in all over the Europe. It is not only to run in the Germany, but it also adopted by the France, Japan, and the Netherlands, and so many other countries or so many other European countries. When in the Bismarck model, the quality of the healthcare services will be improved, because every healthcare provider or healthcare centers will work out for their quality of services, and he or she will be forced or enforced or motivated for the cost efficient healthcare services. So this model is very good model to run by the government. And when the sickness fund will be collected by the contribution of the employer and employee, it will be fixed for the non-profit income or activities. It is fixed, it is monitored or supervised strictly by the government, and this fund will use only for the sickness fund, for the welfare of the community, of the people, whenever he or she will be needed for the healthcare services. So it is a very good models. The monitoring and supervising of the government agencies or the health insurance schemes are very strict, in which the quality of the healthcare services will be monitored and the cost will be controlled, or the multiple healthcare provider in the market. So the competition is going on between these healthcare providers or healthcare services centers. They will definitely improve their quality services in the cheaper cost or in the affordable cost. I hope in the today lecture it's a clear your concept about the Bismarck model. To watch my video lecture very properly, it will enhance your knowledge about the public health and about its topic. In the last, I request you the bell icon which is you are looking in the bottom of my video. Press the bell icon. By pressing the bell icon, you will get my new lecture as soon as I upload on my YouTube channel. Thank you so much. Allah Hafiz. Take care of yourself.